But ladies and gentlemen, I don't want to take your time. We do want to hear Dr. Larry Goldenberg. Please, would you make him welcome?
Thanks very much, Phil, and thank you all for coming out this evening. And I think what I would really like to do is give you an overview of men's health, what it's all about, where it is, where we're going in British Columbia, and why I think it's very important for men's health initiatives. One of the reasons is this picture right behind me. Who can tell me what that is? So I heard one carburetor. Very good. Because I don't think we use carburetors anymore, do we? But carburetors. Men know about carburetors. Men know what's under the hood of their car, but they don't really know much about what's under their own hood, if you will. But how many have seen a doctor for preventative maintenance in the past 12 to 36 months? Okay, good. How many know their personal risks? Good. Well, why are we here? We're preaching to the choir. Have had a urinalysis, a rectal exam, a PSA, a stool for occult blood, colonoscopy. Had your blood pressure checked. Spoken to your doctor about sexual issues. Can tell me what your cholesterol is. Understand that depression, cognitive impairment, and fatigue may be a result of low testosterone. This is just a small sampling of areas in men's health that have not been tended to very well by most men in society. I'm very pleased that men in this room actually have a knowledge of their risk factors. But you'd be surprised how many thousands of men are out there who do not have a knowledge of just basic things like their family history or their risk factors, or what it means if they're smoking, what the consequences might be, or if they have a high cholesterol, what the consequences might be. It's reflected in these kinds of statistics, in the difference between men and women. Men are 39% more likely to die from diabetes, 84% more likely to die from arterial disease, 70% more likely to die from heart disease, 29% more likely to be diagnosed with cancer, and 40% more likely to die. Huge numbers. 80% of spinal cord injuries, substance abuse, violence, and crime are males. 35% of suicide attempts are male, so the majority of attempts are female, but men are much more successful. And 97% of workplace deaths are male. So you can see that there are issues that need to be dealt with in the male gender. And this is not taking anything away from women's health. On the contrary, we're here to learn from women and to learn from the 30 years of women's health movement and children's health movements. It's time that the male health movement took off and became a real entity, not just in British Columbia, but around the world. So I define men's health as the study of conditions or diseases, risk factors, and treatments that are specific to males across their lifespan. So it's not just men's health, it's male health, it's little boys' health too. Within the context of physical, mental, which is what we usually think of with health, mental health, physical health, but also emotional health, social, and spiritual well-being. So it's quite a holistic look, and it goes well beyond the prostate and the penis. And when we think typically of men's health, and without putting your hands up, I'm sure that many of you think of men's health, they think of the penis, sexual health, and of the prostate. And all those other things are not important. But I'm here to tell you that they are important. And if you look at the lifespan, the male from birth to death, right across here, I won't take time to go through it, but just as you're looking at this slide, pick out conditions in every phase of life that needs to be attended to. And we don't have the healthcare resources in our society to see every man at every year of life. But what we need to develop are the resources to reach out to men to make sure that they're aware of what their risks are for many of these illnesses and things that they can do to prevent them. So is there a need for a men's health initiative? I vote one. I'm a single vote, but I hope that many others will fall into place and will also agree that there is a need for a men's health initiative or a men's health movement. We're often quoting the average life expectancy of men being less than women. And the gap between men and women is anywhere from 4 to 6 years, depending on the year in North America. But in some parts of the world, such as in Eastern Europe, it's as much as 14 years. 14 years. So there's a big gap between men and women. And if you look at the beginning of this, far left, in 1920, life expectancy was around 50 in both genders. And our bodies were really only designed by nature to last for 45 or 50 years. So all these extra years that we're getting are bonuses. And unfortunately, we start to wear out. The parts wear out, as you know. But they're wearing out differently between the ages, or between the genders. And we need to find out why. And because of this life expectancy gap, now some people say, and if you ask some men why men die before women, they say because they want to. That's one theory. We have to do some research on that. The World Health Organization in the Madrid Statement, and this goes back to 2002, and there have been other groups. I just took out the slides because of time here, but just one statement I wanted to read to you from the World Health Organization. To achieve the highest standard of health policies have to recognize that women and men, owing to their biological differences and their gender roles in society, have different needs, obstacles, and opportunities. So again, it's not about taking away from the women's movement and giving it to the men's movement. It's bringing the male movement up on equal ground so that we can attend to the men in our society. We talk of life expectancy, but another indicator that I want you to think of here is health expectancy. The disability and functional dependence-free life expectancy, i.e., how long are you alive and healthy versus alive and not healthy. So if your life expectancy, if you look at the top line there, in the USA, which is roughly the same as Canada, the life expectancy is 76 years for men, but the last 10 to 11 years of life are ill health. So what's the point? I mean, those 11 years, you're sick, you're somewhat of a burden to yourself, to your family, to society, to health economics, and so forth. So a very critical issue, I think, or goal, is to try to decrease that gap between life expectancy and health expectancy. Clearly, the ideal would be to live to the maximum number of heartbeats that the good Lord has given you, and then you're dead. That would be nice, but it doesn't happen too often. Most of the time, people are ill, with an average of 11 ill years before death. So we really want to decrease that gap. Another point, if you look at causes of death, men are the winners in 9 out of 10 of the top 10 causes of death. And on the right side of the slide is just the ratio, the risk factors increasing. So men are 1.4 times more likely to die of all of the top 10 causes than women. Clearly, there are gender-specific issues with women. Men aren't dying of breast cancer, for example, or endometrial cancer. But there are significant illnesses in men, and men are dying at a younger age, bringing the life expectancy down, and there's that gap between health and life expectancy. So the consequences are scary, and these are just a few numbers. Close to 50% of women are widowed by age 65. Over 50% of elderly widows living in poverty were not poor before their deaths of their husbands. And at age 95, women outnumber men 8 to 1. Which is good for the one guy, but